Congrats, you finished your first exam. Now on to the next one. This next one's got a whole lot of stuff, including starting with the leg, working up with the chest, where you got the lungs and the heart. So we'll go ahead and try and cover as much of the leg stuff ahead of time, so that way you guys ain't overwhelmed with a whole bunch of stuff later on. So here, kind of a big old copy of everything you need to know about the leg, and spoiler alert, you got a little bit of pelvis vasculature here and here. I wouldn't worry about this stuff so much, but it will pop up at some point in the future. So just kind of keep a mental log of that. The first thing I want to go ahead and bring your attention to is all the nerve roots. Here we have the lumbar plexus, starting at the very top with your subcostal nerve at T12, well, all the way down to your lumbosacral trunk. I went ahead and organized all of them, starting from the very top to the most inferior. A big thing I really want you guys to know, there is no special mnemonic here. It's just honestly practicing writing it out multiple times till you get it to stick. The big thing I want you to notice here is that the femoral nerve and the obturator nerve share the same roots. One way you could kind of remember it that might help you is kind of like with the brachial plexus, knowing that starts at C5 and ends at T1. Knowing that your subcostal starts at T12, and they kind of seem to borrow from each other, where T12 will come down here to iliohypogastric, then ilioinguinal will have just L1, and then L1 will jump down here to genitofemoral, and then L2 will jump down here to lateral femoral cutaneous nerve, and then you got your femoral and obturator with both L2 through L4, and then your lumbosacral trunk will get your L4 through L5. So hopefully that's somewhat helpful. At the very least, you got all of them right here in an organized fashion. I know a big thing, I'll probably release another video kind of helping to explain all of the muscles on the backside where the gluteal muscles are. But to keep your innervations straight for your obturator internus, your quadratus femoris nerve, and your piriformis nerve. A big thing to kind of keep straight in your head is that the nerve to obturator internus also will innervate your superior gemellus muscle, and your inferior gemellus muscle will be innervated by the quadratus femoris nerve. So basically the big thing I have here on this little study guide is all of the nerves and their roots in regards to the backside or anything with the leg. So I hope that helps. The big kind of mama I want to get through here is all the blood supply starting from the aorta going down to your big toe, okay? This is all of the blood supply for the hip/perineum area. I don't think you guys will need to know this for this exam, so you can kind of ignore that for now. A big thing to kind of note is that when your aorta comes here, it will split into a common iliac artery. Kind of like how in the arm you had your common interosseous artery, and this takes place at the L4 of your vertebra. You could kind of remember it as the bifurcation at L4. You also have another significant bifurcation at T4. That's the bifurcation of your bronchi for your lungs. That's just something to kind of put in the back of your noggin up until now. So at L4, you'll see a bifurcation of the aorta, giving off your common iliacs, where you'll have your right common iliac and your left common iliac. And then you'll have another split where you have your internal iliac, which will give off blood supply to all of the hip and perineum area, and then your external iliac, which will eventually, once it crosses the inguinal ligament, which I'm sure you guys are plenty familiar with at this point, it is now turned into the femoral artery. A good way to kind of remember the femoral artery is going from lateral to medial is the mnemonic navel. Starting on the lateral side, you have N standing for femoral nerve, and then medial to that is your femoral artery, and medial to that is your femoral vein. And that is all contained in your femoral triangle area, indicated with the top part of it being your inguinal ligament. Then you also have your sartorius crossing across here, and your adductor longus. And right in between your nerve and your vein is your femoral artery. Okay, so I've kind of talked enough about that. Continuing off your femoral artery, you will have a deep femoral branch. The deep femoral branch is significant in that off of there you will have your medial and lateral circumflex arteries. I know that they have I know that they supply the blood to the femur. I can't remember off the top of my head if it's the head or the neck, but know that these guys are very, very significant, especially if you end up, let's say, dislocating your hip. I know that these arteries are likely to be ruptured or injured in some fashion. And very similar to whenever we were talking about the arm, you will have an ascending branch, well, I guess in this case, a descending branch coming up here to kind of form this very important anastomose between the lateral circumflex artery, the descending branch from this area, and yeah, I don't have the notes for here, but make sure to know this anastomose because I know that's a very popular question to know about. Let's see here. You also, once the femoral artery has passed through here, it will go through a structure that's just deep to the sartorius muscle. Underneath that is your adductor hiatus. Whenever you get past that, it is now considered the popliteal artery. Okay? The popliteal artery, you can actually feel the pulse of it if you reach right behind your knee, and that is the major artery that you can kind of feel going down into your leg. Just like with the arm, you'll have a bunch of genicular arteries coming off of it. I don't have them specifically named. Just know that if it's on the lateral side, it'll be the lateral superior genicular. If it's on the medial side, it'll be the medial superior genicular artery. Okay? And then same goes for the inferior geniculars. If it's on the medial side of the leg, it'll be the medial inferior genicular artery. If it's on the lateral side, it'll be the lateral inferior genicular artery. Okay? You still with me? I hope so. So anywho, we're still continuing down with our tibial artery, and then at some point it will branch into the posterior and anterior tibial artery. The anterior tibial artery is significant because it will go onto the top or dorsum of the foot. It will then pass under the ankle or extensor retinaculum of the foot and is now considered the dorsalis pedis. This is just like with the popliteal artery and the femoral artery. You can feel a pulse on the top of your foot, and that pulse is your dorsalis pedis artery. And then it will have very smaller structures that it will feed into to give blood supply to your toes. And then, like I said, the popliteal artery gives an anterior tibial artery and does a posterior tibial artery. This guy is important. If you go to your medial malleolus and just reach under there, you will feel a bunch of ligaments and your artery. That is your posterior tibial artery. That sucker is extremely significant because it does all the blood supply to the muscles on the bottom of your feet. So if you're looking at the bottom of your foot and something's talking about blood supply, it's going to be your posterior tibial artery. Of course, once you get down past the medial malleolus, you will have a lateral and a medial plantar artery. So if it's on the medial side of the foot, more than likely it's probably going to be the medial plantar artery. If it's on the lateral side of the foot, probably the lateral plantar. I'll release a video kind of talking about the minutia about that later on. Okay, so now that we got the blood supply knocked out, let's go into the nerves. I feel like the nerves are a little bit more straightforward to get down on this one compared to the arteries. And I will reference all of the muscles so that way you can kind of have an idea on what's going on there, okay? Alright, cool. So, with this guy, just like before, we have our sciatic nerve, which is made up of L4, L5, S1, S2, and S3, okay? And that sucker is coming down here, and it's actually kind of a bundle of your fibular and tibial nerve. It is a huge nerve. I don't think you'll ever mistake it. The big thing to know is that not always, but mostly, it will be coming underneath the piriformis muscle up in the gluteal region. If you've ever heard of Piriformis Syndrome, it's where if you have a super tight piriformis muscle, which is an external rotator, it will clamp down on your sciatic nerve and give you sciatica paresthesia, which is basically kind of, loss of feeling due to like just not having nerve conduction because the piriformis is just too tight. Okay? So once the sciatic nerve comes down, at some point it will split into your common fibular nerve, and just like with anything with common, you know it's going to split later on, and your tibial nerve. Because like I said, the sciatic nerve is basically a compilation of your fibular and tibial nerve. Okay? So now that we have this split, our common fibular nerve will split into a superficial cutaneous branch and a deep fibular nerve. The deep fibular nerve will do the anterior leg, and the superficial fibular nerve will do the lateral aspect of the leg. The lateral leg is just 2 muscles, so wouldn't worry about it. But all the anterior muscles are going to pass through there and get innervated by the deep fibular nerve. I also know that the deep fibular nerve will come in here and do cutaneous sensation between your big toe right here and your second toe. So any cutaneous stuff down here, that's your deep fibular nerve. Everything else on the top of the foot is going to be for cutaneous is going to be your superficial fibular nerve. And then anything underneath on the bottom of it is going to be supplied by the posterior tibial nerve, or just tibial nerve. Excuse me. Let's see here. Yeah, so we got that. We covered that. So deep fibular, yep. And then the tibial will also, of course, like I said, just like with the blood supply, will split off after it passes the medial malleolus, just like with the posterior tibial artery, and do a medial nerve branch and a lateral nerve branch. Okay? Excellent. And we'll get into more details whenever we cover the foot. So here I have all of the muscles. Ignore the scratched out ones, but here's all the muscles that you're going to need to know for the nerve and blood supply. My best advice, honestly, is just draw this out and go through it as many times as you can. Once you have kind of like your system down, and I'll provide another mnemonic later on, is Sergeant Fought. That is SGTFOT. And Sergeant Fought is significant for the arteries and is significant for the nerves and the compartments of it. In fact, actually, let me type that out here. Sergeant, and then Fought. Okay. So for the anterior compartment, the representative muscle for that is sartorius muscle, okay? And the nerve that gets the sartorius or anterior compartment of the thigh is your femoral nerve. And then for the medial aspect of the thigh, you have the gracilis muscle, okay? And for the nerve that goes with that is the obturator nerve. The obturator nerve is going through the obturator canal, and that provides all of your medial aspects of the thigh, like your gracilis, your adductors, and your obturator externus. It will also do pectineus, but pectineus is dually innervated. It will also get the femoral nerve in addition to the obturator nerve. So just kind of be aware of that. And then finally, the T for sergeant will be semitendinosus. Okay? And that nerve is the tibial nerve / sciatic. Okay. Sorry, I just had to share that mnemonic with you, and that will get you at least in the ballpark. Like I said, know your exceptions. I know another exception is the short head of biceps femoris, which I have indicated here is innervated by the common fibular nerve. So just kind of be aware of that. Don't want you guys to get confused or tripped up on that. This mnemonic isn't perfect by any means, but at least it gets you in the ballpark. And then continuing down here, we have our two tendons of two muscles for the lateral legs. It's nice whenever they're super simple like that. And you get the superficial fibular nerve, because remember how we said the deep fibular nerve will go to the anterior aspect of the leg and all those muscles. The superficial will get these two guys. So it's nice and simple, and your fibular artery will get the lateral leg. So it makes sense. It's near the fibula, all the stuff on the lateral side. So that should be straightforward. And then here's all of our anterior leg and our posterior leg muscles back here. A good thing to kind of keep straight in your head is that the ligaments for the lateral aspect of the leg will be on, the lateral aspect of the foot. And they're going to attach to various structures on the bottom of the foot for the most part. And all the stuff from the posterior leg, they're all going to pass under the medial malleolus. So, like I said, we're going to get more into detail here. This is just kind of like a little preview, so to speak, for the foot. I'll release a separate video for that. I hope this is super beneficial. I kind of turned up the speed, so if you need to slow me down, sorry for kind of fast talking you guys, but look forward to teaching you guys some more anatomy, and I hope this helps.